Good morning. Can everybody hear me okay? Okay, I'd like to introduce Hidalgo County Judge Richard Cortez.
Thank you, Carlos. Good morning, everyone. I have partly some prepared comments that I want to share with you today. Today, we want to give you an update of where we are in Hidalgo County regarding this COVID-19 matter. There have been a lot of significant developments this week relating to the public health and well-being of Hidalgo County residents, some which caused a lot of confusion. Our hope today is to update you on the number of the different fronts to clarify some misconceptions and to answer your questions that you may have. We're about to reach two tragic mile makers in our community. We will soon reach over 100,000 people that have contracted or tested positive for COVID since this COVID-19 matter began. More tragic, we're also about to surpass 3,000 mark for those who have died from this disease. All of this is happening as our hospitalization numbers continue to go up and our capacity to handle COVID patients is becoming a growing concern to all of us. Our two top health experts are here to elaborate on these trends, but one startling number is our hospitalization rate. Earlier this year, the percent of patients being treated for COVID was at our hospitals fell to a below number of 3%. We were excited to see that. Yesterday, though, our COVID hospitalization rate stood at nearly 26%. That means that 1 in 4 patients in our hospitals are now being treated for COVID. And that the first misrepresentation or misperception that I want to address is that these numbers are rising partly because of the continued reluctance by some members of our community to get vaccinated. Right now, 90% of those hospitalized for COVID have not been vaccinated. This is a problem of our own. It is a wholly owned community problem. I say that because I see increasing evidence on social media and personal communication that people want to blame the current surge of immigrants for our uptick in COVID cases. That simply is not true. You will get some more information of that in a minute. The COVID numbers are going up because people still are not wanting to get vaccinated. We must get our community vaccinated. This is particularly true as we begin school year next week. Virtually every elementary school student is not vaccinated because they're not eligible to be vaccinated. As long as those eligible for vaccines do not get the vaccine, that will be endangering these school children. I think that would be selfish and certainly unacceptable. While all of this is happening, we're also contending with the capacity issue as it relates to migrants seeking asylum in the United States. That's become a big issue.
It's a big problem, not a big issue, it's a big problem.
Hidalgo County and the city of McAllen are moving aggressively to deal with this capacity issue because of the threat of COVID with these migrants are bringing. But simply because they bring the threat of this virus does not mean that they are currently spreading the virus in our community. The bigger threat right now are those residents in Hidalgo County that are not being vaccinated. People are rightfully angry, as you witnessed today, that the county and the city are paying to accommodate these immigrants. Yes, it's unfair. Yes, it should be a federal responsibility. But I have an obligation to keep the people in Hidalgo County safe, and that obligation now extends to finding these immigrants accommodations until we know they pose no danger of spreading the virus to our community. Whether these migrants are legally crossed our international border makes no difference. Our current federal law is that these people have applied for asylum, they were processed by Customs and Border Protection and released. They are legally entitled to stay in our country until their case is heard in the immigration court. We in the county level and those at the city level here have no legal authority to prevent these asylum seekers from preventing them from coming into our community. We do, however, have authority under health laws to isolate them until they pose no threat to the community. That is precisely what we're doing. That is where our resources are being spent. Our declaration of local emergency is the first step in laying the legal claim to the reimbursement by the federal government for these expenses. That is another misconception that I want to clarify. Our declaration of local emergency is different from the declaration of emergency made by Governor Greg Abbott on May 31st of this year. His declaration specifically has to do with immigrants who entered the country illegally and who are evading detection. Those are illegal immigrants that he is referring to. To be clear, just as the governor asked several months ago, we still do not have a major violent crime issue with this illegal immigrants that the governor is focused on. Part of the information I wanted to give you today is I asked our local law enforcement people, the sheriff's office, to give me a report of the incidents that they have received this year regarding immigrants. There have been 27 incidents reported dealing with criminal mischief or property damage. The total property damage assessed was $43,750. So there has been no increase in violent crimes in Hidalgo County because of illegal immigrants. In fact, the government does not have the authority to do anything with illegal asylum seekers that are coming in, which are the basis for emergency declaration. I want to tell you that we are in a bad situation regarding our nursing shortage. All of the hospitals have beds that are available to treat our sick people, but there's no nurses available to fill those occupations. So we do have a capacity issue. I'm asking all of the nurses in our area, to step up, come back and serve our people in our area. It is time for you to come back and help us in this very critical place. I'd like now to turn it over to Eddie Olivares, our Public Health Director, to give us some more specific information and statistics about this disease. Eddie?
Thank you, Judge. Good morning, everyone. Eddie Olivares, Hidalgo County Health and Human Services. Today, it's a great honor to be here today and give a current update of our COVID situation. I want to start off by a very general statement that's very important. Okay, I want to start off by a very general statement that's very important. I'm going to give a lot of data today, so you guys got to refer back to your recording. On July 12th of this year, there's 25,684 active cases in Texas. That's according to the state dashboard. 25,684. This morning, there's 126,950. That's over 100,000 more cases, active cases in the last 2 weeks. So this is not just an Hidalgo County problem. This is a statewide problem, and this definitely is a national problem. This is something that's very important to understand. It's not just here, it's all across. Next thing, the statement that Judge said is extremely important. We ask that all healthcare professionals, particularly nurses, please re-engage into assisting and supporting our hospitals here locally. It's very important. Your role as lifesavers is critical to our community. And we ask each and every one of the healthcare professionals in our community, especially nurses at any level, to please re-engage and continue to provide the wonderful support and assistance you've done in the past and help our current situation now. Now, today, we have 390 cases that were reported. We had, out of those 390 cases, 197 of those are less than 19 years of age. We've seen a high increase in the younger people being positive. Now, we got to understand that the current vaccine is only for 12 and older with Pfizer. So we have many of those that are very, very young. 173 of those are less than 50. Talking about the majority of cases were over 50. Now, the majority of cases are less than 50. And those are the ones that are in the, that we have active cases. That's not hospitalized, I'm talking about active cases. We continue to work closely with our hospitalization. Currently in the hospital as of this morning at 7 a.m., we have 315 people in Hidalgo County hospitals. 315 people. That's right at about 30% of our total staffed beds in Hidalgo County. A third of all our beds have COVID patients currently. A number that's very, very alarming and is very important to look at. 17 of those cases are pediatric. 7 of those 17 are in ICU. We have 7 in ICU, pediatric ICU. 3 weeks ago, I had 2 cases in the hospital, none in ICU. Very important. These ICU numbers for pediatric are increasing. In conjunction, there's this concept that the immigration are flooding our hospitals. In the last 48 hours, there have been 4 immigrants admitted for COVID, primary treatment of COVID in the hospitals. 4. Okay? Now, that's not including other things, broken legs, other illnesses. I'm talking about COVID. Primary diagnosis of COVID, 4 in the last 48 hours. Very important that we look at that. As of right now, we have 195 in med-surg. 40 of those are on ventilators. 67 are in ICU. We have the 17 pediatric and 7 are in ICU. And we talked about the age group. That's very important. Next thing I want to talk about is our vaccinations. Hidalgo County has done very well with vaccinations, but we continue to need more help in that area, especially 18 to 30 years of age. Currently in the hospital, 85 to 90% of everyone who's in the hospital for COVID, out of those, 315 patients? 85 to 90% are not vaccinated, guys. They're not vaccinated. So vaccine is a primary concern for us, and it's an easy fix. In Hidalgo County, total dosages as of this morning, 460,809 people, 460,809 people have been fully vaccinated, according to the state MTRAC system. That's a very high number. When you sit down at least one vaccine or fully vaccinated, when you combine them, 979,639 people in Hidalgo County have had at least one vaccine or are fully vaccinated combined when you add those 2 numbers up. So our vaccination rate is good, but it can be much better, especially with that 18 to 30-year-old group. Very, very important. Our immigration numbers, I want to go over something real quick with you all. From the middle of February through yesterday morning or last night, there's been 87,936 immigrants that have been assessed. And out of those 87,936, 7,274 have been positive for COVID. And the testing they're using is rapid Binax testing provided by the state. That's an 8.27% positivity rate over that period of time. However, we've seen an increase in positivity rate in the last week or so. Yesterday, there was 1,470 immigrants that were processed. 236 were positive for COVID. That's a 16.05% positivity rate. Prior to the last 10 days or so, the positivity rate was less than 10. We're seeing a slight increase on that. Just being transparent and clear with everyone, we're monitoring that closely. We have today a very important announcement that I need to bring up today. Let's talk about variants. Everyone's asking about variants. We have 18 new Delta cases as of this morning. 18 new Delta cases as of this morning. That brings the total to 23 Deltas. Now, we're breaking down the age groups, locations. That will be on a separate press release that will be done later today. Mr. Sanchez and I will work on that because we just got that information at 9:30 this morning. We have 16 British, 1 Californian, 7 Brazilian, and 23 Delta. So that brings a total of 47 overall cases of variants since we started testing and assessing for variants in Hidalgo County. Very important to bring that up. We ask everyone to focus. What is the number one way to combat variants? The vaccine. Simple. Get fully vaccinated. Don't worry about which variant might be out there. If you're fully vaccinated, it lessens the probability of you having serious medical complications that warrant hospitalization. By you being vaccinated, it assists us with not having more people in the hospital. The other thing I need to bring up that's very, very important is the back to school. Oh, hold on the Delta variant, I got to bring something up too. It's an interesting number that we're looking at. Out of the 18 Deltas, which should not be alarming, this actually is something that is contained. 10 of the 18 Deltas were in nursing home facilities. 10 of the 18 Deltas were in nursing home facilities. So just want to let you know that even the elderly are still very high at risk. So this is a combination of staff and residents of the nursing home. So 10 out of the 8 that we're announcing today were at nursing homes. Back to school vaccine, not to be confused with COVID vaccine. Back to school vaccine. Everyone, all students are required to get their back to school vaccine, the measles, mumps, rubella, Tdap, all those vaccines before you enroll in school. We ask each parent, please, 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 please get in contact with the county health department, with a pediatrician, with a local pharmacy, and get your back to school vaccinations. You need those to enroll in school. School starts in the next week, 10 days. Please get your back to school vaccine. The other thing that's been discussed a lot is masks. Okay, we've had this discussion many times, but recently it's come back up. There was a handout given to each of you made available, Mr. Sanchez made available on masks. Masks work, folks. We need to look at the fact that pre-July, pre-outbreak, we kept up with our mask wearing, we kept up with good hygiene, social distancing. Our numbers were lower. After 4th of July, with the 4th of July holidays, with vacation, with travel, all these things, people have been all over the place. They're bringing it back. It's being spread again. Masks work. Why do they work? Because the droplets. You got to look at the droplets and the barrier. So from that perspective, that's my report. Again, I ask all healthcare professionals, please to re-engage, especially nursing staff, and look at getting back into providing support and assistance to our community. I'd like to introduce Dr. Melendez, our medical authority, to give you a medical update and a view from the hospitals.
Where's the stool? I'll see me okay. First of all, I thank you all for being here today. I see a lot of faces that I've seen over the last year. I'm very grateful. It always makes us feel very comfortable to see your faces out there because you know that we all share the same objective from the judge, from the commissioners in the back, from your health administrator and myself, which is to do what's in the best interest of our community. You guys are crucial in getting the word out, and we appreciate it. We like the difficult questions. We want to be as transparent as we can be. As you know, my name is Ivan Melendez. I'm the health authority. I meet with my colleagues on a regular basis. They asked me to remind you this morning that I represent them and the general opinions that they have. Of course, with 765 licensed physicians in our county, I can't speak for all of them, but I can certainly speak for the vast majority. So those people that deliver our babies, those people that operate on our brains, those people that we see on a regular basis, we take our parents to, those are the people that we trust. And so I want you to know that because everything that I tell you is going to be based on the audience, you all trusting us. And so if you trust these folks with other issues, please trust what they're saying. And I'm here representing them. One of the most interesting things that I've seen in the last 2 years in reference to trust is every time, and it's almost 3 or 4 times a week that I make a diagnosis of cancer on a patient, the first thing that they say is, I want to go to MD Anderson. I want to go to MD Anderson. And that's appropriate. I think that's a very smart thing to do. People just trust MD Anderson. But yet when MD Anderson comes with a full paper that says masks work, we need to wear masks. Some of these people say, oh, I don't trust those guys. They don't know what you're talking about. And so I come here representing that part of our community. I'd like to place my comments basically on 3 very simple things. One is, what is the current situation with COVID? The second is, what is the impact of perhaps the illegal entry of migrants who are now legal migrants that are here in our community?
They're not legal, I'm sorry. They're not legal.
So I'll be happy to address any of your comments, but I would respect you if you would respect me. So when I'm through speaking, then you'll have your opportunity. Yes, sir. But in the end, be fair to your colleagues. And so my point being is that 3 comments. One is based on the health of our community. Number 2, the impact of the legal migrants. And number 3 is, what can we do about it? So where are we now? 3 Fridays ago, we had 46 people in the hospital. Today, we have over 300. Last week, the number of people that were hospitalized, only 5 to 7% had been fully vaccinated. Today, almost 15% of the people that are in the hospital are fully vaccinated. In addition to that, where are we today? The beds 2 weeks ago were abundant. The beds today are getting extremely tight. The most difficult resource that is not available to us is a human resource. The human resource are the nurses. The nurses have left, the nurses have gone to other places because there are many who have been following the COVID virus around the country. I don't blame them. Their salaries are 5X, 7X what they would get here. And so we can't blame someone who's going to move because they have life-changing salaries. And so the result is out of almost 2,000 beds that we're licensed for in our hospital, we only have enough staff for about half of that, for about 1,000. Are we in a situation right now that if you get sick for any reason, the hospitals are overflowing and you cannot get help? Absolutely not. Absolutely not. Is there one administrator right now that has not called us and asked for assistance in staffing? All of them, and rightfully so. We want to be a resource. We want to work with them. But our beds are becoming a jeopardy. Our numbers are dramatically exploding. Why is that? Why is that happening here in the Valley? Well, guess what? China's closing down their cities. The whole state of Texas is having a huge problem. Around the country, we had a 400x increase in this problem. Unfortunately, we are not unique. So we're mirroring exactly what's going on in the rest of the country and most of the world. Even our positivity rates. Our positivity rates tend to go between 12 to 16%. And that's what the positivity rate of people coming from all 153 countries that we've seen in this area that are migrating. The positivity rate in the migrants that are coming in are almost exactly as the positivity rates here. What's interesting is when we first started testing these folks, they were at 3.5%, 4% positivity rate. Now they're like us, 15%. Does that mean we're infecting the migrants? Does that mean that we're a danger to the migrants? Absolutely not. Of course not. That just means because they stay here for 2 or 3 days. What that means is that they're coming across and they're posing a risk, not only to us, the people who take care of them, but to the rest of the country where they're going. But, pardon me? Absolutely. We've had 4 Border Patrol agents die. That means that people are taking care of them. That doesn't only mean the Border Patrol agents or the doctors or the nurses. It means everybody. The people at Whataburger that they were not supposed to go and they went to, whoever you want to identify. But they're not posing more of a danger than myself. I've been in 7 COVID units today. And so my point is, yeah, more people, more danger. But it's not more people with higher rates. That takes me, I guess, to the next point. Where are we today? The variants. We now have over 2,000 cases in the United States with the Lambda variant. The Lambda variant is a variant that's found in Peru. In Peru, it's at a 15% mortality. Delta, which we're all familiar with, as we know, the Delta variant, the ancestral virus that started in Wuhan 18 months ago, is not the same virus we're fighting today. Just like us, when we were coming into being, those people that were lived in the north tend to be lighter colored. Those people that lived in the south and hot areas tend to be darker color. So we have mutations too, such as your plants, the bread that we eat, the corn that we do. It's completely different than it was 500 years ago. So this virus that's been on this world for 3.5 billion years versus humans that have been here for 200 years, who do you think is going to be able to mutate? Who's going to be the stronger enemy mutation? Of course, it's going to be the virus. So we've had billions of years to adapt. We've had 100,000 years to adapt. These viruses are sneaky. The Delta virus, as you know, that we know of, has at least 4 mutations. 3 allow it to be stickier and to go unnoticed. And the other mutation allows it to cleave because it's like pulling the sleeve off an IV needle to cleave that needle and penetrate the cell. Delta virus, 1,000 more viral load than the ancestral strain. So if you're infected with the ancestral, you're infected with the Delta, you're going to have 1,000 times more viruses than the person who had the original strain. The Delta variant, we only have an 85 to 88% efficacy versus 95% efficacy with the mRNA vaccines. So we know that these variants are causing an issue. I believe that the reason our numbers are exploded, and one, of course, is because of the variants, because we know that at least 80%. Why do we only have, how many do we have? 18? Why do we only have 18 Delta today? Why do we only have, say 20? Why do we have only 20 Deltas that we know of in New York? Because we're not testing. You know, up until our elected officials were kind enough to call their colleagues at the state level, we were actually allowed to submit more testing. Before, we were submitting 3 cases a week. Last week, we submitted almost 100. This is a direct impact of having our elected officials ask for help, and they've responded. And so what is my personal belief of the Delta variant? Vast majority. So when we say there are 20 cases, it may make some news because people are keying on the word Delta. But for us who dedicate our lives to this, yeah, there's probably significantly more than that. And so the variants, the lack of vaccination, and the people not paying attention to the things we've asked them to do before are all contributing to our numbers increasing. I guess that leaves me from where we are. And let me just say it's not all bad news. Where we also understand there's some good news. What is the good news? We've had record amount of first-time vaccinated people. There are more people coming out to get vaccinated recently than we have in the past. We have better ways of treating this. I think the elected folks in our community have been able to network more effectively with the people who give us our resources at a state level. There's a strong commitment between the hospitals, the health departments, private industry, the media. We know that all of these factors are completely necessary for us to be successful. So there's good news. That's our current situation. My last comment on our current situation is I think the public greatly underestimates the danger that we're in right now. And that it's creating an incredible amount of work for us to come behind the conspiracy anti-vaccinated people, giving out information that scientifically just doesn't hold true. The migrants. You know, I had prepared something for the group of doctors that I was checking with to see what their opinions were before coming to you again today. And just 2 seconds. The numbers continue to increase across the board. Our migrants are also suffering. Hundreds a day are being identified as being positive with a positivity rate of 16%. Imagine the difficulty of sheltering these infected human beings. Regardless of our philosophical, political position, they're here and they're part of our community. Maybe briefly, but their impact is not brief. No one can argue that our immigration policy is broken, but it can only be fixed at the national level. We are where the rubber hits the road, and we do not have any other option except to deal with it head on. You know, the tents were being set up. You know that the people that were going to be out there was an attempt to try to help place them in a safe position for them and for us.
Not safe for us, it's right in the middle of my neighborhood.
We don't need this. Thank you.
Sorry, I don't like what you're saying, I'm sorry.
Well, but we're in a civilized society, and so we need to have our turns. Otherwise, I can't give you the message.
Sorry.
I respect your opinion. In fact, I agree with a lot of the positions that you probably take. There was a shelter, the very first one, placed in front of my mother's house on Hackberry and Second.
Not in my backyard.
I understand, but I love my mom as much as you love your mom. And so I was one of the people who went to the city and said, I think this is a safety issue. And it was changed. Yesterday, people in your community did the same, and it was changed. So I think we have a dialogue and respect each other's opinions. And guess what? They're not in your backyard anymore. So what can we do now? What can we do now? Well, we can identify the things that we can do about. There's some things we can't do anything about. We can't impact what the virus does. We can't impact what the pharmaceuticals do and designation of vaccines and money. We can't do the immigration policy in Washington. We have to face to what we can do. So what can we do? Well, first and foremost, we know that there have been 6,000 people, I think it's 6,540 people that through the adverse effect reporting system that were fully vaccinated that ended up in the hospital. And of those 6,000 people, there were about 1,114, I don't have the number exact, but a little bit over 1,000 that died. Here in the Valley, we've had 4 people that were fully vaccinated that have died. We've also had 400 kids in the country that have died. Here in the Valley, we have had 3 kids that have died. So to believe that more people die from the vaccine than from the disease is utterly ridiculous. We've vaccinated 4.1 billion people in the world, and we've had 4 million people die. In our community, we've vaccinated 900,000 people, 900,000, and we've had almost 3,000 die. So it absolutely, the numbers, the math, the lack of political or of subjective comments, vaccines work. Because people have died that have been fully vaccinated and the numbers have been significant, that tells us that because you're vaccinated doesn't mean that you can't move around as if you're a Viking, right? You have to still take those precautions. And so when we look at all the different things that we can do, when I was in Iraq, when I was with the 101st, when I was in Fallujah, they didn't send us out with a hat. See you later. You know, we had M6s, we had sidearms, we had vests, we had helmets. So we had a whole constellation of tools that we were going to do with the enemy. The enemy, of course, has completely become more sinister, more aggressive, and more effective. And so we have to use all the tools that are available to us. No one can doubt that the number one tool, the nuclear bomb, is the vaccine. But we also have masks and we also have social distancing. Without a shadow of a doubt, if you are infected, pardon me, if I am infected and you all come to interview me, Are you going to want me to wear a mask or not wear a mask? Be honest. If you're, well, probably you would, but most people would not. And so most people would say, I'm going to admit my mom to the hospital. Okay? We have 6 nurses, 4 are vaccinated, 2 are not. Who would you want to take care of your mom, the vaccinated people or the unvaccinated people? Okay, be honest with yourself. Yeah, be honest with yourself. I can understand that based on your extensive experience in dealing every single day, which just irritates the heck out of me. So we get the disease, we die. Doctors and nurses, we die, over 1,500. We have people that have dedicated their lives. They're 70 years old. They wake up every morning. That's all they do is read and research. They're not millionaires. In fact, they make less money than the average physician seeing patients in their office. We're the lowest paid. And yet this is what we do. And we do it only for one reason, because that's the way we're wired. But that's our life. And then we have people that really do not have any experience whatsoever and are based on what they read somewhere, and they're the experts. And the problem is not that, is that they're peddling death. I want you to know that the 6 people that I've admitted since yesterday, all 6 of them were unvaccinated. All 6. Okay? Of the 300 and sort people that are in the hospital, 85% are unvaccinated. So you tell me vaccines don't work, really? Okay. The other issue that irritates the hell out of me is that people suggest that we have some type of hidden agenda. If you look at your elected officials, they're here because they have a passion, not because there's some financial motivation or anything to prove. It's ridiculous. It's offensive. So to finish my point, if you look at people who use masks, if you look at people at social distance, if you look at studies around the world, if you say this country, this state, this place enacted mask mandates or mandated social distances, the numbers are dramatically proving that it works. The problem is we're just not COVID. There are other issues that we have to do as human beings, other issues. So when people say the suicide rate has increased, well, I looked up the numbers. The suicide rate in people that last year that went to school, guess what? The first 6 months of 2020, the suicide rates went down. No one's going to argue that it's not a mental health issue when your kids are at school. But don't make an opinion without looking at the facts. And the facts are the numbers went down. Why? Because the kids consolidated with their families. So my point is this: vaccines, social distancing, and face masking. It's math. 2 + 2 is 4. They work. The numbers here, are they increasing? Absolutely. Any more so than any other place? No. Are the migrating folks part of the problem? Absolutely. The migrating folks are part of the problem. Are they the problem? No. Are they bringing the disease in? Yes. Are they bringing diseases in that we already have here? No. Is their positivity rate greater than our positivity rate is? No. Are they filling our hospitals with their healthcare needs? No. Are they impacting our border patrolmen that died? Yes. Policemen die every day out in the field doing their job? Yes. Did I, the judge, Carlos, did we all get infected with COVID and we're sick? Yeah, it's part of our job. Absolutely. Some of you reporters have gotten sick being out there. I mean, you know, if you're afraid of guns, then don't be policemen. If you're afraid of getting sick, then don't be a healthcare person. So yeah, but are they the problem? No. Is this a pandemic of the migrants? No, it's a pandemic of the unvaccinated. So anyway, thank you for your attention.
Thank you, Melendez. At this point, we're going to entertain questions from certified media. Because this is being live streamed, I'd like for you all to raise your hand so we can get the mic to you. And also, I want to let you know, I know there are questions about the temporary shelter that Hidalgo County is involved in. I would ask you to withhold those questions because we are going to have a press conference this afternoon on site. We will have details for you at the end of this press conference as to where to go and what time to be there. So I would ask you to withhold questions regarding the temporary shelters that Hidalgo County is involved in. At this point, I give it over to over there.
Good morning. So you mentioned earlier that there's some shortage of nurses, staff at hospitals, and Dr. Melendez mentioned that some of them have left. for higher paying job, maybe contract work. I was wondering if there was a number about how many nurses have gone somewhere, just a figure, I guess, on the shortage in the
Doctor, do you have that number? Just for your information, we have been in communication with all the hospitals, and we're trying to compile all that information in terms of numbers and compensation and what are our options available. But I'll let Dr. Melendez address that if you can.
Thank you, sir. I don't have the exact number, but I was told by one administrator last week that 30% of their nursing folks have left. I will tell you that rounding in the hospitals yesterday, there was actually a group of people that were all discussing how many were going to sign up so that they could go somewhere else so that they could get 5 times their salary. So the problem is not only has occurred, it's still occurring. Actively, people are still signing up to work with agencies. So we don't have the exact number, but I would estimate it's around the 30% mark.
Pues para la comunidad hispana estamos aquí para decirles que ahorita tenemos una situación que necesitamos que toda nuestra gente se vacune, que se vaya a vacunar. Estamos teniendo más gente que se está yendo al hospital, más gente que se está enfermando y queremos la única manera que podemos poner una defensa de eso es que se vacune.
Hello. Good morning. Back to English really quick. Mr. Olivares mentioned he's looking for nurses or anyone like that to re-engage. What exactly do you mean by that? Are you calling for retired nurses to step back in, or what's it all about?
So it's like Dr. Melendez said, there has been a high percentage, a significant number, I don't have the exact number of nurses and healthcare professionals who have transitioned either to working for agency or work in other parts of the country. We're needing right now with our increase in inpatient admissions, we're needing a lot more support from nursing and healthcare professionals, nurses, medical assistants, respiratory therapist assistants. All these type of healthcare professionals are needed in an increase in our community. That's all.
Something for you all to visualize. Just visualize that we would have normally 1,000 beds available. The hospitals still have 1,000 beds available. We don't have nurses to administer or serve half of those beds. So then just by the mere fact that there's no nursing to be able to support those beds, then that capacity just was cut in half.
El mensaje también para la comunidad hispana, sobre todo por los dos números que hablaban un poco, es tener suficientes camas, más no suficientes personal médico, y el número de casos pediátricos que están llegando a la mayoría de los más en comparación a la pasada.
Pues primeramente para los diferentes medios de comunicación en español. Después de esto me junto con ustedes para discutir más en tema en español. Eso se puede hacer, pero ahorita mismo se ha hecho varias diferentes labores para asistir. Tenemos 390 casos nuevos de COVID, pero en el hospital hoy mismo tenemos 315 casos en el hospital. 30% de las camillas que están en los hospitales están usadas para COVID. Tenemos ahorita pediatric cases, tenemos 17 pediatric cases y los 7 están en ICU. Pero después de esto podemos comunicar más datos en español. Gracias.
I have a quick question. I know we've been talking a lot about vaccination rates, and so it seems as though 85% of those in the hospital are unvaccinated. I know there's a huge concern for those in our community that are unvaccinated. What is the unvaccination rate of our population? And I mean, even if it's a ballpark figure, but also where can people go to get back? Where can they find that information? Because I think the conversation goes through cases. I think it's something important to know.
So right now you need to carve out a couple of things. We have about 1.2 million people in Hidalgo County approximately. You subtract those that are less than 12 because they can't get vaccinated right now. You have maybe about 300,000 or so, about 25 or 30% of those are probably young children. So right now, when we're looking at a percentage rate of about a third of our population from anything from 30 to 4% of our population that might not be vaccinated in a vaccinate appropriate group, we still have a lot of people who are not vaccinated. Now, a lot of those are students. And a lot of parents, I understand, they're cautious and concerned about vaccinating their students at 12 and older, but we've had a lot of response and positive response to vaccination. However, the 18 to 30 age group continues to be the biggest population that is not responding well to vaccination. So we ask them to please take part in it. Thank you.
Question over here.
Any other questions from certified media?
We have one.
You wanna take it?
All right.
We're open to
That concludes our press conference. Thank you very much.
I have a question.